Hi, I'm Dr. Jason Dulac coming to you from my office in Springfield, Virginia. Today I wanted to talk to you about routine dental checkups and why they're important. So why get regular dental checkups? We've all heard the saying, an ounce of prevention is worth a pound of cure. That's so true in dentistry. The sooner you catch a problem, the cheaper, quicker, and easier it is to fix. If you're waiting for a tooth to become painful to treat it, you're either looking at a root canal or an extraction, a more expensive, more involved procedure. We always want to get cavities small when it's just a filling, get problems quick and early so we can identify them. You have time to take care of them on your schedule, not on the tooth schedule. If you give it enough time, that tooth will break or cause pain, and you will be in the office on the tooth schedule. So routine cleanings are great to maintain the gum health and also to catch problems early so that they don't become bigger, more expensive, more time-involved problems to fix down the road. How often should I get a dental checkup? So in the state of Virginia, you have to get a checkup every 10 months in order to do any other work. ADA recommends every 6 months. Um, for patients that have some gum disease or some other things going on that we need to see them more frequently, we'll let you know if we need to see you at 3 or 4 months. We don't always need to do an exam at those visits, but twice a year is a good go by for a checkup at the dental office. Can dental checkups prevent oral health issues? Yes, absolutely, 100%. Um, One little story here. I had a patient come in with oral cancer. It's pretty rare. We are actually seeing the incidence go up, surprisingly. So smoking has gone down, but alcohol use is still pretty prevalent, and oral sexual practices have kind of trended up. So that seems to be the reasons that we're seeing oral cancer tick up. Of course, a lot of cancers are ticking up, so maybe other things in the environment, but oral cancer is still on the rise, unfortunately, even though smoking is down. Um, Oral cancer is best caught early. I had a patient come in over COVID. She almost canceled her appointment because of COVID. Found oral cancer, found it early. Every time I saw her for the next 2 years, she thanked me for saving her life. Most of the things we do in dentistry are functional, cosmetic, to keep the health of the mouth, gums, health of the teeth and gums maintained. People with healthy teeth and gums live 7 to 10 years longer, but oral cancer screening is one of the things that will save your life. And that's part of every exam. Every time I see you, she actually wasn't in the office for an exam. She was just there for some work, but I saw it. We caught it early, got her over to a good surgeon, got it removed, and she's here today for that reason. So, in addition to checking for cavities, checking for gum disease, checking the joint, an oral cancer screening is part of every exam at our office, as is an airway screening. So, help identify other issues like snoring and sleep apnea that could cause other health problems. But it's absolutely critical that you get your healthier teeth and gums checked on a regular basis. One question I get a lot is about kids. Um, American Academy of Pediatrics and Pediatric Dentistry recommends a dental home for people by the age of 1. So having someplace you can go when you're 1 year old. Up till 3, it's just visual exams. Starting at 3, we start to polish the teeth. Starting at 5, we start to try and get x-rays. But um, again, the earlier you catch something, the cheaper it is going to be to fix. I'd rather prevent a problem in the first place than have one. But if we can't prevent it, I'd rather catch it early, save you time, save you money, save you expense, and keep you healthy. Is a cleaning included in a checkup? Could or could not be. At our office, most of our patients come in for their cleaning and exam. We can always see you for an exam separately. We can always do a cleaning separately without an exam, as long as you've had one in the last 10 months. The state of Virginia, you have to have an exam every 10 months to have any other treatment done. But typically they are done together, but they don't have to be. Are x-rays included? Yes, x-rays should be included on an annual basis, for the ones between the teeth, the bite wing x-rays that show the cavities between the teeth where we can't see, and a periodic set around the mouth and bone every 3 to 5 years, depending on the patient, is always a good idea. Again, I can only see so much visually. The x-rays to get in there to see where I can't see visually, prevent problems before they start. We do have a 3D x-ray machine at my office, so for implants, root canals, if there's something crazy going on, we do have the latest technology at my office, 3D scanner, 3D x-rays. to get the best diagnosis possible so that you can get the best treatment possible. What does a dentist look for at a dental checkup? Check the joint for pain, popping, clicking, tension in the muscles, oral cancer screening, generally examine the head and neck for oral cancer also. I do an airway screening for snoring and sleep apnea. We check the bite, the growth and development of the teeth and gums. We check the gum health, make sure the gums are healthy. And of course, we check the teeth for cavities. And if you have any cosmetic concerns or elective concerns, Invisalign, orthodontics, whitening, anything like that, if that's of interest to you, you can bring it up to me at that time as well. How long does a dental checkup take? Depends on the patient. If you've been in recently, you're in good health, you need no x-rays, could be 5 or 10 minutes. If you're a new patient to the office, you need x-rays, we need to go over your health history, we need to do a comprehensive exam, there's more going on, we might want to get some diagnostic molds. Uh, could take half an hour to an hour. Do dental checkups hurt? No. Checkups shouldn't hurt. If you've had a bad experience in the past or you're aware of a certain area that's always sensitive, let our hygienist know, let me know. But the exam shouldn't hurt. The only time that we would want to induce any pain during an exam is when you come in with a toothache, you're aware that it's a tooth that's bothering you, but you don't know which one it is. We have to replicate those symptoms to identify the problem sometimes. And to do that, we might tap on a tooth or blow air, put cold on a tooth to try and see which tooth is bothering you. But generally speaking, most exams are visual exams, which don't hurt, and the x rays, which don't hurt. Periodically, we do need to measure the gums. If the gums are healthy, that doesn't hurt. If you're having any pain when the hygienist is doing the gum measurements, that's a sign you got something going on, some gum disease, periodontal disease, something's going on there that's causing that. Your mouth should be pain free, just like the other areas of the body. If they're healthy, it should be pain free. Nothing we're doing during the exam should induce any pain. If it is, let us know. We'll take care of it for you. What's the best way to schedule a checkup? Give the office a call. You can text us, email us. Website is dulacdes.com. Our phone number is 703-451-4500. You can call us or text us at that number. I look forward to seeing you in the office soon, and please give us a call if you have any questions.